Good. So we're doing a teaching session on basic interrupted suturing. Do you want to introduce yourself to the camera?
Sure.
Yeah.
My name is Suraj Kadiwal and I'm a medical student, third year.
Great. Have you ever done any suturing at all?
Not at all.
Fine, so you're a complete novice. So before we begin, we'll go over a bit of like theory and stuff. So this is suturing material. This is something called proline. It's made of polypropylene, and you can see the needle is curved. And obviously, this is all sterilely prepared because we're using the operating room. As I'm sure you know, that needs to be a sterile field. It's an aseptic procedure. And why would we use sutures? Do you think? What do we do with them?
Fix another cut or
Yeah, so we're doing it's
basically binding the skin together.
It's to approximate wound edges.
Yeah.
That's it.
Okay.
So whether that's tissue inside a cavity in the abdomen or whether it's skin, all you're doing is approximating the edges so that healing can occur via the primary healing pathway,
Right.
and not secondary healing where it grows from the base up. Cool. So we've got some equipment here. So these are sutures, as I mentioned. This is a sterile suture pack. A lot of hospitals have these. They're nicely arranged. They have some suture equipment, including some stuff which we'll go over now. We open it up in a sterile way. Obviously, in real life, you'd be gloved up and everything. Yeah, we'll do it with our exposed hands for dexterity's sake in this instance. Right, so we open this up. Okay. We'll open one of these packs. I've got two different sizes here, but we'll go into theory in a second.
Okay.
Cool. So this is something called 3-0. The lower the number, i.e. 3, the wider the diameter of the needle and the suture. So here we've got some overlay dressing. So this is just, say, if you had a wound, you could lay it to one side and give a nice field. This is somewhere you can put some saline to wash out the wound if needed. Scissors, non-toothed forceps, toothed forceps, needle holder. That's it. That's all you need in a basic suturing set. Should we run through the names again? What's this? Needle holder.
Needle holder, non-toothed forceps, toothed forceps.
Awesome. Good. Okay. So what we'll do is, we're just going to suture directly onto one of these packs. Okay, it's the easiest thing to do. So what we'll do is I'm just going to go through the steps once, then I'll break it down, and then I'm going to get you to do it, and then I'm going to get you to teach it back to me.
Right.
Okay, and we'll summarize with a bit more theory and stuff, the process. So watch me closely, how I pick stuff up, my technique and the flow. Alright, so I won't talk for this one. Done. Okay, that's an interrupted suture, single interrupted. You can see it's gone underneath. You can imagine if this was two edges of a cut surface, then you'd be able to suture that up.
Yep.
Okay. What we'll actually do, just to make it a bit more sense, is we'll just cut some flesh, just to give us a border to cut into. So now you've got a superficial surface and a deep surface. You've got a nice edge that we can suture in a second. Okay. I'll show you one more time, but I'm going to break down the steps. Okay. Fine. So needle holder.
Yeah.
Notice that I'm picking it up. Right, it's almost like a spine. Like that's the lumbar lordosis, the thoracic kyphosis. And you're picking it up in between your ring finger and your thumb. Okay, that's how you pick up any surgical instrument. Do you know why we do that? Because it gives you the most flexibility and stability at the same time. You just have to rotate your wrist, and you can keep your hand just in one plane to do that motion. Your wrist does the rest. So it's the best way to do it. Then, if you notice, I picked up the suture from there.
Yes.
Okay, I should put it back in just to show you a little bit. Suture. Never touch the needle with your hands or with your two instruments at the same time. Only one instrument. So it's in there. Okay. You pick it up, pull it out, and it comes out more nicely. You can maintain it within the sterile field. Okay. Then we come to the tissue. We've got our cut. Okay. And notice how I picked up the needle. I picked it up in the middle, just at the end of the last third. Okay.
Yep.
So split up into thirds. Everything in surgery is split up into something. So this is in thirds.
Yeah.
So that would be too close if you picked it up there. That is, it wouldn't give you the maximum rotation, and that one would be too unstable. So that is the best of every factor, which is why we pick up in that third. You get the tooth forceps. You know why we wouldn't use these ones?
Just slip out.
It's more to do with surface area and pressure application. So it wouldn't slip out. It's actually the opposite. It would be too painful. It would be too traumatic to the skin. Because if you can even use them to pinch yourself. If you compare that to this, see which one is more painful on the skin if you pinch yourself with a relatively similar amount of force.
Yeah.
That's a lot less pressure. So you damage the skin if you use it. This you usually use for inside tissue, so muscle, stuff like that, where you actually, it's slippery, you actually need to get grip. It doesn't matter too much if you damage it a little bit. Bowel and stuff, you'd use that because that's more likely to perforate the bowel. But anyway, good. So tooth forceps on skin. So you look at the wound. In this case, you would have like cleaned it out. You would have made sure that it's nice and clean. Then you grab one side, okay, like this, and you invert the edge. Or you bring it outwards. And with the needle, the idea is you're using the natural curvature of the needle just to do a rotational movement, just by keeping your wrist as the pivot. Okay? So you lift up the edge, and you go in about maybe just under 6 or 7 millimeters from the edge in this case, but it's variable dependent on what the needle is. But the main principle you have to remember is you go down as far as you've gone out.
Okay.
You understand? Yeah. So you go down, imagine we're going down as far as we went out, and you come up, okay? And you do one side at a time. You don't go all the way through both sides, because you'll get bad approximation. Okay, so we pick up the needle again. Pick the needle up. Careful not to touch the needle.
Do you always hold it from the needle itself, or can you hold it from the actual?
You mean, do we pick it up from here with the instrument?
Yeah.
You try not to, because what will happen is you'll most likely damage the suture. And remember that this thing is the thing holding the patient together. So you just try and be as light with the suture as possible. So you'll often just pick up even with the tooth forceps, because it's not actually being touched. It's just floating. Then you pick this up in the last third. So just pick up a bit nicer. Pick up in the last third and secure it. That's actually, it's often a bit difficult. Don't do this. Try not to do this, but sometimes you have to. Just make sure you don't do that in an exam or anything. Okay. So you go through again, same thing, just as deep as I was, and you come out the other side. Okay. And this is all before we start doing knots.
we did the first side, and now we're just doing the second
So
side.
now we just went to the other side.
Okay.
So now we've just got this loops there, but don't worry about that. So now we've got this gone through, okay? It's inside the wound.
Yep.
So what we want to do now is, you pick up one side. You've got the short end in there, you've got the long side on here.
Yep.
You get your instrument, okay? And you go one loop around, two loops. Okay, you want to see it again? One loop,
Yep.
two loops. This is called the first throw. And after you've done those loops, you maintain it on the instrument, and you pick up the tip and you close of the suture, and then with your other hand that's still holding this, you pull it in the opposite direction from where you picked it up from.
Okay.
And you see the nice thing is you see how it's approximated, and also you see that the knot is flat.
Yeah.
If I pulled it this way, you wouldn't see that flat knot. So that's what you want to aim for every single time you do a throw.
Okay.
And in this case, we're going to do 3 throws for reasons to be. That's what we typically do. But often there's other circumstances where you have to do more. Okay, and then I just did the same. So instead of doing 2 throws, what I'm going to do now is you just do 1 throw. 1 throw. Pick up. Sorry. 1 throw. Pick up. And then you pull through, just like that. Okay. You see how it's all come together now?
Yeah.
And then last time, 1 throw. You can do the throws either that way or this way.
Okay.
It doesn't really matter too much. 1 throw. Pick up. And then up. Like that. Good. And then you can just cut the ends. Is that? Okay.
And if you wanted to do more and carry on, how would that work?
You do another one, so you pick it up.
You got to do it. You start all over again.
Yeah, so if you want to do another one here, so if this was the original wound,
Yeah.
So if you want to do one here, you have to go through again.
So you start all over again.
Yeah, that's how you
So you
work.
can't, it's not continuous.
Well, there are other ways you can do this, but this is the fundamental suture.
Okay.
This is the one that you have. This is the first one you learn. And we can do some other ones a bit later on, but learn this one first. So I'll leave that prepared for you, or if you want, you can try from the start because you have to learn how to pick up a suture.
Okay.
So
In terms of the gauge, right?
this is the 3/0. Yeah.
What like on a normal wound, what would you use?
So on a
Skin.
normal skin,
Yeah.
3/0 is fine.
Okay.
Okay, you can use 4/0, but it's a bit more fillily.
Okay.
If I was working on, say, an artery inside of you,
Yeah.
I'd use this because it's a bit finer.
Yeah.
And you're trying to limit the amount of stuff that you have inside the intimate because that's, if you refer to whichever eponyms, whoever's law it was, that says if you have turbulent flow,
Yeah.
stasis, and hyperdynamic state, hypercoagulable state. Yeah. So that's why Volkov's triad. Yeah, it's Volkov's triad. Fine. So let's go through this.
Right.
Show me, and then we can
this first.
just pretend you're picking out from there, but you can just pick up from the table. It's fine.
All right. So I'm gonna pick this up.
Yeah.
Ring finger.
Yeah. Good.
And then you put the 2 on the side.
Yeah. Practice opening and closing again. So close it, okay? And now how do you open it? So you push. So it's sort of
You push down. And then
push out. So if you look at these, you see these ridges.
Yeah.
So when you open, you kind of want that action. So you kind of want an
So you
opposing
can
flow.
to the side.
Yeah, so like your thumb pushes it that way,
Okay.
and that sort of drags it that way a little bit, and it will become unclipped. If you just try and do that,
Yeah, you can't.
it's not going to come through.
Right.
Yeah, like that. That's how you do it. Make sure you lock it once the needle is in.
Right.
Otherwise, you'll get slippage of the needle.
Okay. Right. So we're gonna go.
Put your index on just somewhere over there, just because it gives you
The side?
on there. Yeah, then that gives you good
Okay. Yeah.
control.
So we're gonna lift it. We're gonna pick it up from 2/3. Then we lock it.
Yeah. One sec. Let me just see if this is recording. One sec.